Hi Ian, how are you?
Good, how are you?
Good. My name is Susan. I'm a nurse practitioner student from Maryville University. And I'm told you're here for your annual physical. Is that true?
Yes.
Good. And before Ian came into the room, he had his vital signs taken. He had his height and weight taken. He also had the Snellen's chart done. So his vision is 20/20 on both of his eyes. He also did have the near and far vision done to outside. Right now, Ian, I will be touching you. I'll be giving you some instructions, and I hope you're comfortable with that. Did you empty your bladder?
Yeah, just used the restroom.
All right, okay. And Ian doesn't need a gown. Right now, what I'm doing is I'm just inspecting to look at his face and his skin, and his skin looks good to me. It is well moisturized, it's not dry. I'm going to start by assessing his scalp, and I'm looking at the hairline, and I don't see anything wrong with that. I'm gonna palpate his scalp now, and what I'm doing, I'm looking for any lumps or masses, and I don't see any. I'm also looking at the texture of his hair, and it doesn't seem, it is okay. I don't see, it is not thin. I don't see any baldness, so he's good. The next thing I'm gonna do, I'm gonna assess his cranial nerves, and what I want you to do for me, Ian, is can you close your eyes tight? Good. And when I'm doing that anyway, I can still check his lacrimal apparatus, and I'm gonna do that right now. And I don't feel any bumps or lumps. Open your eyes for me, thank you. Can you frown? Can you smile? Can you puff your cheeks? Can you clench your clench your teeth? Can you try to move your jaw either side? Good. I'm still assessing the cranial nerve of functions. Can you shrug your shoulders for me? Again. Good. His cranial nerves are intact. The next thing I'm gonna do is I'm gonna assess your eyes. And what I want you to do for me is I'm gonna look for eye fixation. Can you cover one of your eyes and look right over my shoulder to maybe the door there, on the door there, and cover that. Cover the other one. Still look straight there. Good. I don't see any eye movement. I'm gonna now check your sclera and your conjunctiva, and his conjunctiva is pink. His sclera is white, which is a good thing. I'm now gonna be shining some light on your eyes, and I'm going to be looking for the pupillary reaction, and direct and consensual, and direct and consensual, and his eyes are reacting to the light quite okay. I'm also looking at even his eyelashes, and they look okay. They are well, they're symmetrical, so he has no problem with that. The next thing I'm gonna do, I'm gonna assess the 6 cardinal directions of gaze. And what I want you to do is I want you to look at this pen, and I only want you to follow the pen with your eyes and not your head, okay? Do you see any doubles? Good. So he's doing okay in that area. The next thing I'm gonna assess will be his ears, and I'm looking at his ears, and they're symmetrical. I don't see any problem there. I'm looking at his auricles, and they look okay. I'm also gonna use the otoscope to look at his tympanic membrane. Okay. And it's good and gray. I don't see any waxes or any drainages. It's good. The next thing I'm gonna do, I'm gonna assess his hearing. Ian, can you cover one of your ears? I'm gonna say a word and I want you to tell me what word I said.
Up.
Good. Cover the other one. Baseball.
Baseball.
Good. His eighth cranial nerve is intact. I'm gonna hit this and I'm gonna place it on top of your head and I want you to tell me whether you hear it on both ears or on one ear. Okay? You hear it on both ears or
Both
one?
ears.
Good. Then I'm still gonna do this. I'm gonna put it on your mastoid, at the back of your ear. That is his mastoid bone. And and when it stops, when you stop hearing the vibration, you let me know. And I'm gonna put it on his. Then I'm gonna test him his the air conduction, and the air conduction should be double the bone conduction. Okay. Tell me when you stop hearing it.
Stop.
Okay. Stopped.
Yeah.
I'm gonna do that on the other ear too. Okay. Good. The next thing I'm gonna do, I'm gonna be assessing your nose now, and his nose is okay. It looks symmetrical. If you can tilt your head just a tiny bit for me. I'm looking at the septum and the turbinates to make sure that the septum is in midline, and he has no drainage or anything on his ears. I don't see any. The turbinates are pink, and his septum is in the midline. Can you close one of your ears and breathe in? What I'm looking now is patency of his nares. Can you do the other one? Good. Are you having any trouble breathing in?
No.
No. The next thing I'm gonna be assessing now will be his mouth, and his lips are moist. And Ian, I would want you to, can you stick your tongue out for me? Good. Put it back, that's good. Now I'm gonna be assessing his mouth now. Open your mouth for me. And what I'm looking for, I'll be looking at his buccal which is pink, and it is okay, open wide. I'm also looking at the arrangement of his teeth and the color of his teeth, and they look okay, and he's missing his wisdom teeth. Can you lift your tongue up? I'm looking for any, under the tongue, for any oral cancer, and I don't see any problem there. The next thing I'm gonna do, Ian, I'm gonna put this in your mouth, and and what I'm testing now is the gag reflex, and then you're gonna say ah. Open your mouth for me. Stick your tongue out and say ah. Yeah, and I see his uvula. It is okay, and he has a good gag reflex. I'm now gonna go down to his neck, and first and foremost, I'm gonna assess his. I'm gonna palpate for his carotids, each at a time. And can you look on one side? I'm also now I'm assessing his jugular vein, making sure that I don't see any raised pulsation, which I don't see now. I don't see any. Look back this way. I'm now trying to I'm palpating for his trachea, and it seems to be in the midline. And now I'm checking his thyroid. Can you swallow for me? Good. Good, that's good. The next thing I'm gonna do, I'm gonna palpate for his for the lymph nodes, and just relax. I'm gonna start with pre-auricle, post-auricle, tonsillar, mandibular, submental, superficial cervical, posterior cervical, occipital, subclavicular, nodules, I don't see anything, and then now the deep cervical, and I don't feel any nodules there, so he is good. He is good. The next thing I'll be assessing will be his chest now. Can you sit up straight? Yeah, that way. And what I'm gonna be, I'm just looking at his chest, and I'm looking to see for any lifts or heaves, and I don't see any. He's not using his accessory muscles. He has no problem breathing, so which is a good thing. I'm gonna now. I'm also gonna palpate his chest, just to make sure that I don't see anything, and I don't. And while I'm doing that, I'm gonna do his check for his tactile parameters. Ian, if you could say 99 for me.
99, 99, 99, 99, 99.
Good. I'm also gonna percuss his chest, just making sure that good. I'm now gonna listen for his breath sounds, and I'm gonna, before I even go to his breath sounds, I want to auscultate the carotids first, and I'm gonna use my bear, and I'm palpating the carotids to make sure that I don't hear any thrills. Good. All right. Okay. Now I'm listening to the breath sounds now. And I don't hear any abnormal breath sounds. While I'm still there, I'm also gonna listen to his heart sounds. But before I do that, I'm gonna palpate for his apical impulse, which should be on the 5th intercostal space, mid-clavicular line. Oh, and I can hear that. I'm now gonna listen to his heart sounds. Gonna listen, that is the aortic, pulmonic, arbs, tricuspid, and mitral. I'm also gonna use the bell to listen to that. Aortic, pulmonic, arbs, tricuspid, and the mitral. As I also listen to the apical impulse, and I can hear that very well. The next thing I'm gonna do, I'm gonna assess his posterior chest, and I'm gonna go to his back. And like I did, I'm gonna first palpate to make sure I don't hear anything. And Ian, can you say 99 for me?
99.
Good. I'm checking for tactile fremmeters back here. And now I'm also gonna percuss his back. The next thing is I'm gonna listen to his breath sounds at the back here. Can you give me some deep breaths? Good. 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 The next thing I'm gonna do is I'm gonna look for thoracic expansion, and I'm gonna go to the 10th intercostal space. And I'm just gonna watch my thumbs diverge as he breathes. Good, and that's good. The next thing I'm gonna do his diaphragmic excursion, and I'm gonna percuss, and I'm gonna measure his diaphragm. And what I'm doing right now, I'm percussing from until I hear the notes change from resonance to dullness, from the 3rd intercostal space. There. And I'm gonna mark there. And I'm gonna go down here, and now I'm going from the notes from I should hear notes from dullness to resonance. There we go. I'm gonna mark there, and then I'm gonna measure this. Which is about 5 centimeters, which is good, because it should be between 3 and 5 centimeters, so it's good. The next thing I'm gonna do, oh, and I forgot to check your light sensation. And what I want you to do for me, can you close your eyes? And before you close your eyes, I'm gonna be touching you with this. And when I touch you with this side, it should be soft, and this should be sharp.
Okay.
So I want you to tell me whether I'm touching you with the sharp or the dull part, okay?
Okay.
Close your eyes.
Soft. Soft. Dull. Dull.
Okay, good. All right. I'm gonna have you lay down.
Not bad.
Huh? Yeah, on your back, yeah. And now I'm going to assess Ian's abdomen. And I'm looking to make sure that I don't see any lumps which could indicate hernias or masses, and I don't see any. And what I'm gonna do, I'm gonna auscultate first for the bile sounds on all 4 quadrants. On the right quadrant, left upper quadrant, left lower quadrant, right lower quadrant, left lower quadrant, And I hear he has good bile sounds. I'm also gonna auscultate for the arteries, and I'm gonna go aortic, aortic artery, left renal artery, right renal artery, left iliac, right iliac, and left femoral, right femoral. And I'm gonna look for the aortic pulsation here. Good. The next thing I'm gonna do is I'm gonna light palpate him, and just to make sure that I don't feel any masses or anything. And then I'm gonna do deep palpation now. And I don't feel any masses there. I don't feel anything. I'm gonna percuss his abdomen. And while I'm doing that, I'm gonna measure his the size of his liver, and I'm gonna go here. Well, I'm gonna measure that. It should be between 6 and 12 centimeters. About 7 centimeters, which is good. I'm gonna percuss for his spleen, and what I should be hearing is dullness. The next thing is I'm gonna palpate for his right kidney. Side and palpate his left kidney. Good. If you can sit up here, I'm gonna check for any tenderness of his kidneys, and so I'm gonna check his costovertebral angle, and tell me if you feel any pain here.
Okay. No.
No?
No.
All right. I'm gonna now start assessing his upper and lower extremities now, and what I'm doing now, I'm just checking for the temperature and the warmth, and he's good. I'm looking at, I'm checking for his capillary leaf field. Nice and brisk, no problem. I'm gonna feel for his radio. And brachio pulses. And now that I'm there, I'm also gonna check for his the brachio reflex. Good. Can you fold your pants for me? The next thing is I'm gonna assess now his legs, and I'm just looking at the skin. It looks okay, and the hair distribution, which is good. He has no peripheral vascular disease, which is a good thing. And what I'm gonna do right now is that I'm gonna check his reflexes, and let me do his pulses first. I'm gonna check his pulses, the popliteal pulses, and posterior tibial. And I'm gonna have to do this for a minute. And dorsalis pedal. And I hear the pulses, which is good. And the next thing I'm gonna do, I'm gonna check his reflexes. I'm gonna do his knee. And I'm gonna do his Achilles. I see he has good reflexes there. You can put back your pens. The other thing we are gonna do is, can you stand up for me? I'm checking his spine, and here, this way. I'm checking his spine. Can you stand straight? And I don't see any deformities there. Can you bend for me, Ian? All the way, like you're touching it. Yeah, it is smooth. I don't see any kyphosis or scoliosis, which is a good thing. All right, that's good. I'm also now gonna check his muscle strength. And you put your hands this way. Push down. Up. Good. Yeah. Push up. Push down. And that brings us to the end of your assessment. Ian, do you have any questions for me?
No.
Good. And so that we come to the end of assessment. And I can tell Ian that his assessment was negative. He has no issues, and which is a good thing. Thank you.